Give me some.
Give me. Give me 5.
But it's like.
So that's the
Crest.
crest,
Yes.
yep. And then let's do the clavicular head.
Is there
It's the medial portion of the body.
Yeah, so we're gonna come in here. So let's just go from here. Oops.
in
Go here. And then we get the
You have to take a bath before anyone.
it comes off with
With the cream.
cream or alright, and then we got the we'll do the sternal. So this is the S and the C. The treatment will be on this side, but I'm gonna demonstrate. Alright, Pectoralis major. So as you guys see here, and you may want to, it probably look better. I don't know if you can see it better from here. So you'll see here with the pectoralis major, all right, the insertion is the crest of the greater tubercle of the humerus. So right here was the greater tubercle of the humerus. We got the clavicular head, which obviously we guys know that this is the clavicle. So you see the clavicular head, and then we got the sternal head as well. And then we also remember that the cartilages, it also attaches to the cartilages of the sternum as well. So the 1st through 6th rib is where you get the attachment for this pec. So with this pectoralis treatment, your goal is not to spend too much time on this sternum, although it does feel good to, you know, loosen up that sternum if you need to. Anytime we're around this pec region, male or female, you want to make sure with your draping that the nipple is covered up. All right, so as you see here, once I cover up this nipple, we do lose that lower portion of the pec. With the draping with the women, depending on the size of the breast tissue, make sure that tuck is tucked pretty well. All right, so the goal is to come out from the sternal head, from the origin, make its way to the insertion. Because if we try to strip towards the origin, kind of grabs the tissue of that pec. So you see how much easier it is to grab that tissue. So if I come around here on the treatment side, we'll get started. First things first, you just want to address, you know, warming up that area. So you see a little bit different than what I do down in the lower body. You'll see that my fingertips are up a little bit more in the air, because if they were down more, I might have an issue. So you'll see here as I go up, it's kind of like a glide up. So what's causing most of that pressure before I go in and start doing some friction work is the palm of my hand. So as I'm sinking in, feel that, Jim? I can go deeper if I need to. What are the areas that we need to avoid that if we compress it a lot?
The acromion.
Yep, the acromion area. Any compression in this area is going to cause a little bit of irritation. So what I'm doing here, I'm making sure that I'm addressing the clavicular head and then that sternum head. So the angle that you come at with this, obviously we have to remember we have the client's face in the way. So you don't want to sit here and start hitting them in the face. So any stripping, you got to make sure you make sure that you avoid that. I can come at either direction because I'm pretty comfortable with it. But you'll see here, once I start stripping that pec, you okay with the pressure? I'm starting with that sternal head. And I'm making my way out towards that. All right. So whether I do the flat hand with the scoop. All right, now I'm coming around towards that clavicular head, avoiding the face. So now you see how I'm coming in with the left here and the right here. Resting my hand on the deltoid. And just a little rest there. How you feeling? Yeah. Now it's the clavicular head. Go ahead.
I didn't think of it as a head, but it is, right? It all attaches like
Yeah.
flat to the,
Yep.
the clavicle, right?
Yep. So I'm here. I know I'm right on that clavicle, and I'm going. Try to keep it in a direction. All right. Now, if there's problems in the pec, I need to go a little bit deeper. Now I'm using my fist. Now with this, if I want to relieve some issues in that pec, what do you see here? You see the pec coming, making its way to that greater tubercle humerus. Now I can get underneath. So I'm right underneath this pec. And now this is a little bit deeper now. I'm underneath and I'm creating. So I'm not in the auxiliary region. I'm right on that border of the pec. And I'm creating that lift. So here now I have control and I have full access to that clavicular portion of that pec. Sorry, Jimmy, I'm beating you up. But if he did have a trigger point in there, I would be able to get it.
With that grab
yeah.
tissue.
So I'm right under here. You see it? So I'm right under here, and I have that full pec head.
That's one of the few muscles where you can actually grab the bottom
Yeah.
of it.
Yeah. So again, I'm angling that arm because I know that that's where that insertion is. So now I got the pec on a stretch. So even on the stretch, I could strip it. Just make sure you're not causing any stress to that shoulder region, because if I press down here, then it's going to cause some stress. So if I'm just holding it out, just in case I need to bring it in. You okay, Jim?
He says that, but he's not.
Yeah. So this is giving me a full pec treat. You can see it's nice and red. Mm-hmm. Got some flow in that area. I came in from the sternal, clavicular, and then I got in a little bit deeper from this angle. All right, so any questions on that? No. All right.
I guess when that's going to be, what you were doing is a little bit, I don't know if you can.
Once I got here, this is more advanced. Yeah. This is more, but the other stuff you guys can do. Yeah. That's not a problem. So you can start. You can start this one, the sternal.
Mm-hmm.
You can get the clavicular. And even you can start the angle. So I'm not even putting it in a stretch. I'm just opening it up a little bit. I'm creating this angle here so I can get in on it. You guys can start that.
Never compress the clavicular, no?
Nah, you don't want to compress into that.
Here, the sternal. No
The sternal, you can get in and do friction, but I'm never gonna do any CPR type compression.
Yeah.
You might want to break up some of that fibrotic tissue, because remember, most of the times that crack in the chest is just the cartilage. You know, when a person opens up their chest, it's just that cartilage area. But sternum, you don't even, unless you're doing pec work, that's the only reason you would open that up. Okay. All right.
And when you work the pec minor, do you normally just do friction on that?
Pec minor, which is unique, that's a good question.